this afternoon, or good morning if you're the other side of the world to us. Thank you for joining. We're now sort of halfway through day one of our second virtual conference. This presentation, unfortunately, you've got to listen to me, I'm afraid, for about half an hour or so. And I'm talking to you about a new initiative, which is the Wolfram Syndrome Global Awareness Day, which you will have seen mentioned in the newsletters that have been sent out after the over the last couple of years. Couple of quarters. So this is something that's been sort of rattling around in my brain for the last few years, and I sort of eventually came up and spoke with Stephanie from Snow Foundation and asked her what she thought before I then contacted some of the leads from some of the other global WS organisations, and they were all very much for it. So WSUK have been collaborating with organisations in America. There's 3 organisations currently: Spain, France, Italy, Germany, Austria, where they don't actually have an organisation, but we have one or two people affected, so they're linked with Germany, and also a couple of families out in Australia who used to have an organisation, but unfortunately it folded. So I'm going to be helping them again with getting a patient group set up there. So the idea was that we put together this first ever Global Awareness Day. So we went for the 1st of October. It's not a date that was just plucked out of the ether. It does actually have some significance to the Wolfram syndrome community. The date is significant to the paper that Dr. Alan Permott and his team had published in 1998 when the WFS1 gene was identified. So we thought that that would actually be quite a good date to use for this event. This first one, obviously, we've not had a huge amount of time really to get everything together, or perhaps get it as smooth as we would like. So there may well be some hiccups. We've literally had probably about 5 months to pull everything together and come up with the ideas. So for this first event, we're going to be sending organisations in each country and globally within the fields of ophthalmology, endocrinology and diabetes information about those fields of the syndrome. So, for example, here in the UK, we'll be sending information to the Royal College of Ophthalmologists. We'll send information to the Royal College of GPs. We're going to send information globally to the World Diabetes Society. So they'll have the information, and then it will be asked that they then share this information with their member group. It just makes it a lot easier, obviously, for us. If you can imagine, we would have hundreds of thousands of medical professionals to get this information to. So we are also creating a dedicated website for the Awareness Day. This will go live sort of in the week leading up to the Awareness Day, and anyone that has any interest in Wolfram syndrome, whether it's public or clinician, can access the website for information. It'll have the information that we're actually going to be disseminating out to everyone that I've mentioned. And it will also have lists of all the organisations that there are currently around the world. So if there was a new patient, a new person diagnosed with the condition that heard about the day and the website, they can go on there and find their nearest support group for information about Wolfram and the help that is out there. So a press release has also been created, and this is available to anyone that would like to get involved. And one of the reasons for doing this presentation today is we have a couple of weeks before the 1st of October, and we would like as many people around the world to get behind this awareness day and assist us in trying to get the information out there. Obviously, the number of people affected varies from country to country, and there are people out there that are as yet undiagnosed with the condition or have been misdiagnosed. So we want to try and find those people. We want to try and get diagnosis a bit quicker for people. So if anyone has any contacts in media, radio, TV, paper, anything in any of your countries, then contact either myself at Wolfram Syndrome UK or the organisation in your country, and they will happily share the press release to you. So we've drafted it, it's been sent out, and then it's each country can update it to information relevant to them. So like the prevalence of the condition here in the UK is 1 in 770,000 people. So obviously that is different for different countries. So I have a small snippet from out of the press release, and it's basically just by sharing information about us, following our social media pages can have an impact on raising awareness, which could help someone get diagnosed. Even a small donation can have a big impact on the work that WSUK does in supporting our community. There are many ways donations can be made from doing an ordinary online shop, and it's sort of telling about how we want to try and make it a day for fundraising as well as awareness, because obviously with everything that has gone on over the last 18 months, all of the Wolfram Syndrome organisations have been impacted financially. So we're also using this as a way of trying to raise some much needed funds for us. So that is a piece that is in the press release to try and help encourage the public involvement as well. So here in the UK and any of the other WS groups that have a Facebook page, it's been suggested that they create a fundraiser page specifically for the day to help raise funds for their organisation. You know, this is something that everyone can get involved in if they wanted to do a fundraiser or just share the press release if they're able to. So as I say, community members in every country are being encouraged to get involved in some way, whatever is easiest for you. But we're also asking everyone in every country. Now, each organisation does have community contacts in their own country, and I'm sure, like WSUK, we actually have contact details for other countries as well. So we're going to be contacting everyone separately from this talk as well, because we would like you to get involved in a social media baton relay type thing, and we'll be asking you all to join in. So we're going to start at 10 o'clock in the morning in New Zealand, and we'll ask our community there to start posting our Wolfram Syndrome Global Awareness Day logo, which is down here in the bottom of your screen. And we'll actually produce some suggestive text and hashtags that can be used with the logo on social media accounts. So we ask that whatever social media accounts you may use, if you could share the logo with the text and the hashtags at that time, and then hopefully it'll all be spread across social media. So starting at 10 a.m. in New Zealand, and then it will continue to like 10 a.m. in Australia, and so on across every single time zone at 10 a.m. from each time zone. So it's then hoped that obviously every person that shares it, posts it for initially, they will then have friends, family, and contacts that will then likewise share it or retweet it and so on. And then their contacts, we hope, will share and retweet. And that way, obviously, our message, our name can be spread across countries, across the globe. And that is a really, really easy way that you as a WS community member could get involved. If you would like to contact us, so you can have the logo sent to you and the text, so you can have it ready to go, then please do, either here in WSUK or again your nearest community or support group for your country or the nearest country to you. So as I say, if you'd like a copy of the press release and the logo, then contact us. We have, as I say, just under 2 weeks to go, so it's 2 weeks yesterday, and a lot of press agencies, TV stations, they tend to get their schedules, their stories in the pipeline and prepared about 2 to 3 weeks in advance. So we really would need you to contact them now. If you wanted to try and do some sort of fundraising event, then obviously please do. It doesn't have to be on the 1st of October, but obviously that would be ideal. You could plan it for the week after, but link it into the Global Awareness Day, and again, send the press release out to anyone that you know. You know, it's a way of raising awareness. It's a way of fundraising. Any families, individuals here in the UK, if you would like any leaflets sent to you, if you're going to plan to do a fundraising event, then please let myself know and I can get some information sent out to you, or any buckets, shakers, and I'm sure other countries will have information that can be shared, or things that can be shared with you if you're wanting to do a fundraiser event linked to it. So the groups that we have been working with and their email addresses are here on the screen. This will of course be uploaded onto the Wolfram Syndrome UK website, so you will be able to get that information there, or say I can share this information with you if you don't know your nearest, the group in your country, shall I say. So as you can see, as I say, we've been working with Snow Foundation, Ellie White Foundation and Unravel Wolfram in the USA, the French Association for Wolfram Syndrome, the Italian, which is also known as Gentian, Spanish Association, and Germany. So that is basically, it's actually taken me a lot less time than I thought to actually go through what I wanted to say. It's sort of trying to get the information to you verbally rather than just what you've seen through the newsletters and that would be put up onto social media. So I think I might have covered everything. I hope I might have covered everything. Sarah, is there anything that I've missed that you think we should add?
Good morning, everyone. Thank you, Tracy. Can you hear me okay?
Yep, I can hear you.
Okay. No, I think that's wonderful. And I think it's just our message right now, it's so pertinent right now, because we are finding that more people are being diagnosed, whether it's with Wolfram syndrome or Wolfram-related disorder. We have treatments in the pipeline. We have things we can do for this disease that weren't there several years ago. And I just think raising awareness will also help us to further the research, because we know that some of these treatments that are being looked at are applicable to far more common diseases like Alzheimer's and Parkinson's and type 1 diabetes. So it's just a really timely project that you have initiated. Really impressive.
Thank you. I am sort of wondering why I came up with this idea when it's sort of everything sort of is all close to conference, and you know, it's all a lot to get sorted, but hopefully next year when we'll have it under our belts, we'll be a bit more informed, we'll have more time to go ahead, and you know, that's the hope, that we can have this awareness day and we can keep it going as an annual event. And who knows, you know, it might be a case of we can make it so it's longer and it's not just a day, it could be you know, a week. We could have an awareness week or something.
Tracy, You know, it's
Yes.
interesting that you say that. I'm sorry to interrupt, but I was
Fine.
speaking with somebody at our public radio station here who mentioned that people are weary of COVID news, but this is different. This is news that is hopeful. It's progressing. Treatment research has been progressing through this time of COVID, and she said this is something people need to hear about now. So maybe that was in the back of your mind as this evolved earlier in the year.
It could have been. It could have been. And say I sort of it's been rattling around, and yeah, it's just like, okay, we need to do something. And I think that because we see other organisations, you know, there's a Down syndrome awareness day or week, and it's a case of you know, these other rare diseases are well known, and obviously we're not. So I think it's very much a case of we now want to hear our voices heard, and we want to get help and, you know, the research and drugs to help our community and everything. So I think, yes, that's sort of what was there as well. You know, is we now need to start shouting loud to get noticed, and, you know, get any financial assistance from the government or anything like that. So so we'll see what happens. So I don't know if anyone has got any questions that they might like to put to us. If you want to pop them into chat or Q&A, or, as I say, you know, I'm happy to have emails sent to me. You can email me admin@wolframsyndrome.co.uk with any questions that you might have, or requests for information. So I can see, does anyone have anything? I have a very nice comment thanking me and the other associations for our dedication, and the help and effort means so much to all the WS families. So I think, you know, that's something. It's also the fact that we are collaborating more with each other now, and we're not working as individual organisations to try and raise the awareness. You know, this is a good thing, and it helps us as well if we are collaborating with each other. I think we can bounce ideas off each other as well. You know, if we come up with something and think it might work for another country, you know, or we're not sure, you know, we can bounce off someone else and see what they think. So so yes, I think that's it. And yes, information will be shared. It will be put onto the website in the week leading up to the awareness day. I have a radio recording of an interview that I did on Monday this week, which is in the process of being put onto our website. So you can hear me. It's about 6.5 minutes long, and that's going to be broadcast on the 1st of October from one of our local radio stations here in West Sussex, with the hope that it's going to be shared amongst a lot more news stations. It's been sent to their central news desk, and they have access to about over 300 news stations. So hopefully that will then be shared as well. So yeah, so that'll be good. Sarah's just kindly popped a comment up as well. Some of you may have already seen, if you're on the global Wolfram Facebook page, Angela Rearson, who very kindly came over to the UK a couple of years ago and did a psychology workshop. She's been working with other researchers, and Sarah's put, our families may be interested in a treatment for COVID that was discovered as a result of working with Wolfram syndrome patients at WSUK. Angela Rearson has Luvox in a multi-centre trial now, and results are promising. So, you know, and this is something that has been put across, and I know that the doctors have said as well, and Fumi has said this, that research into drugs for Wolfram syndrome are actually quite beneficial. They're finding it has benefits to other more regular conditions as well. So, you know, we've got a lot of things going on, and this research where it helps another condition is actually going to help with Wolfram and raise the awareness for us. So that's great. I've got one of our UK mums who's her daughter has just been diagnosed a few months back. She's just come up to say that she's just emailed her children's schools to see if they'll do a mufti day for us. So, you know, anything like that, if you have children at school, mufti day, non-uniform day, or, you know, if the school's not happy about them doing all non-uniform, you could do something like an odd sock day, or have a colour as another option. So there's lots of things that you can do that could be done as a fundraiser, as well as raising awareness. There's lots that can be done. So anything else? I'm sorry, it's might be a bit quick, might have been a bit rushed. But that's it, basically. That's what we're aiming for on the 1st of October. So you'll be seeing lots being posted over the next couple of weeks on social media. And as I say, even if you can just share on the 1st of October on social media, that is going to be a big help, because that will help spread the name of Wolfram syndrome. And when we have the links and hashtags and everything, people can obviously click on those and find out more about the condition. So I think that's it, really. That's the presentation. Anything else, Sarah? Is there anything you want to add as a final message?
I think you said it beautifully.
Thank you.